Hello, I'm Andrew Paterson, a consultant gynaecologist at Ross Hall Hospital, part of Circle Health Group. I have more than 30 years' experience as a gynaecologist, and during that time I've treated hundreds of women with either endometriosis, adenomyosis, or both. In this video, I'm going to talk you through the two conditions, explaining the difference between endometriosis and adenomyosis, as well as their similarities. Both are endometrial conditions, but they are not the same, and this video will help you understand how they differ. So, first things first, what is endometriosis? Endometriosis occurs where tissue similar to the cells that line the inside of your womb grows outside your womb. This tissue, known as endometrium, can develop anywhere inside your body, but is most commonly found on the ovaries, fallopian tubes, bowel, bladder, or the lining of the inside of your abdomen. Within the womb, the build-up of endometrium regularly bleeds away, leaving the body in the form of a period. When endometrium grows outside of the womb, it can't leave the body in this way. Instead, it continues to build up, causing pain and discomfort, and in extreme cases, adhesions that can affect the function of your pelvic organs. While endometriosis causes endometrial cells to grow outside of the womb, adenomyosis causes the cells to grow into the muscular layer of the womb wall. Each menstrual cycle, these cells thicken and bleed, but cannot be shed through your period. This causes the wall of your uterus to become permanently thicker. This can result in chronic pelvic pain and heavy, painful periods. Do endometriosis and adenomyosis affect different age groups? Endometriosis and adenomyosis can affect any person with a period. However, endometriosis most commonly impacts women between the ages of 25 and 40, while adenomyosis is most common in women aged between 40 and 50. Both adenomyosis and endometriosis are thought to affect around 1 in 10 women worldwide. Both conditions are chronic diseases, and although there are various treatments available, neither has a known cure. Do adenomyosis and endometriosis have the same symptoms? As I've discussed, the most common symptoms of both endometriosis and adenomyosis are heavy and painful periods, and pelvic or abdominal pain that may get worse before or during menstruation, but it is not restricted to your periods. For many people, the pain is present throughout the month. However, when it comes to other symptoms, the two conditions are not the same. Women with endometriosis often experience pain during sexual intercourse and urination, along with bowel symptoms such as diarrhea and constipation. Although these symptoms can be experienced by women with adenomyosis, they are far less common. How long does it take to diagnose endometriosis versus adenomyosis? Unfortunately, both conditions can take years to diagnose. Recent studies put the time to diagnosis for endometriosis at between 7 and 9 years. There are various factors at play here, including a wide variety of symptoms caused by the condition, which can lead to misdiagnosis. Adenomyosis can also take years to diagnose, and again misdiagnosis can occur, as these symptoms overlap with other gynecological conditions. A lack of awareness has also played a part, as has the difficulty of establishing a firm diagnosis without an invasive procedure. If you think you may be suffering with either of these conditions, it is a good idea to seek out a specialist with experience in diagnosing and treating endometriosis and adenomyosis. What are the treatment options? Hormonal medication, such as the combined oral contraceptive pill, commonly known as the pill, or the intrauterine system, commonly known as the coil, can be prescribed to treat both adenomyosis and endometriosis. For some women, the combined pill can provide long-term relief by making periods lighter and less painful. The coil works by releasing a progesterone hormone called levonorgestrel, which stops the lining of the womb from growing quickly, lessening pain and stopping periods. Again, this won't work for everyone. If your endometriosis or adenomyosis does not respond to hormonal medication and your symptoms can't be managed with painkillers, you may need to have surgery. There are various surgical options for both conditions, and a specialist gynecologist can talk you through what's right for you. Thank you for watching this video. If you have any questions about endometriosis or adenomyosis, leave your comments in the section below and we'll get back to you as soon as we can. If you'd like to arrange a consultation with me to discuss any of these symptoms or either condition discussed in this video, you can book an appointment with me at circlehealthgroup.co.uk. Thanks again.